Sent? Let's see.
Good. I have some questions for Dr. Kuhn, and I hope that you can help. I've tried to call the supply line, and they've kind of just been transferring me everywhere, but ultimately they say that we have to reach out to like a sales rep or account manager, so I'm hoping that you'll help. You're completely out of supplies. No problem. And now when you say that he will get put on a list, like how long is this list? Where is he going to fall on a list? The hospitals obviously will be supplied first, FDOH would be supplied second, and then it would be like any events, drive-through testing sites, clinics. Are you the ones that are actually sending out the kits to the Department of Health? Yes, they are asking for kits as well.
The Department of Health is asking for kits? Okay. Wonder where the swabs are manufactured.
I mean, that's just kind of
made in
estimating.
Italy. This is going to be a supply problem if these are made in Italy. I need to call the Department of Health then. Mark Lander.
Dr. Kuhn, how we doing? Crazy.
It is crazy. Okay, I know you're busy. Just a couple quick questions, if that's okay.
Yes, sir.
Number one, any positive results yet in the county?
I'm out of the office right now, but I can tell you when I left the office at 10, there were none. We still have 0 positive. We have results that are pending. We're trying to get back, but we have 0 confirmed cases.
All right.
As of this morning.
That's amazing. Still 0. What's the status on the collection site that the hospitals and the health department are working together? Is that maybe next week?
We're still looking for next week. We've had a meeting already. We met on site, have it all logistically worked out.
Mm-hmm.
What we're waiting on right now is to make sure that we have enough of the specimen media on hand to be able to run that site. And so that's what we're currently waiting on right now.
That's the same issue that I'm having.
Have you been able to order any through lab requests or possibly or anything?
I've got about 18 of them on hand. No, I've got about 15 of them on hand that I had ordered last week, and that's all that I have. We spoke to LabCorp this morning. They're not releasing any more than 5 per provider. We spoke to Quest this morning, and the rep, it went up the chain. The best that they can do for us is to get us in a queue. And it would be a minimum of mid to late next week before they could get us any, and the quantity would probably be small. I've also been in contact with VCOR. They had 100,000 kits as of last week. You know, this is a national lab, and they're and 80,000 are already allocated. The last 20,000 they're reserving for the higher risk endemic areas, and so that's probably a no-go either. So definitely struggling to get kits.
And I think right now what the good news is, I know we put in some requests to our emergency management, and that's where we're going to be getting the supply to stand up this drive-through pod.
Okay.
Coming from that end.
Keep me in mind if there's a supply, anybody gets anything. I'll keep working hard on our end to try and get as many kits here as we can get. We want to get the testing up and running, and just like you do. Once again, I appreciate your amazing work.
Hey, we appreciate you. Appreciate you getting the word out. That's the way we're going to stop this thing.
It's very hard to get test kits. The national test kit shortage that everybody's hearing about, this is what it looks like in action. I'm an outpatient primary care doctor. We have probably 25 to 50 people that we could swab in the next 1 to 2 weeks. And I have 15 kits to do it with. So that's the kit rationing that everybody's hearing about. This is what it looks like, real time. All right, let me see if she got anything else from Quest LabCorp. So everybody that has the symptoms of a viral illness, fevers, cough, body aches, we're doing the rapid flu first. The main reason that we're doing that is we have many rapid flu tests in the country, and we have very few coronavirus test kits in the country. So we don't want to be wasting these on everybody if it's just the flu. So we're starting with flu, then the corona. Yep.
She's coming in for a cough. She's had 2 weeks ago, she had fevers, chills, and all of the other stuff. Right now, all she has is a respiratory and a cough. She's never been tested. She wants to know if you want her to come in tomorrow or just stay home. Come in.
Okay, so she's 20 years old and she's recovering.
She said she had fevers and chills, everything about 2 weeks ago, but.
So let's just assume that she had coronavirus, and then because she was with her sister, then the exposure's probably there. So I need her history. Let's see if she's high risk as well. They're selling N95 masks?
To anybody who wants them for $5 each.
A viewer saw,
A viewer saw your videos on Facebook and wanted to call and let you
and
know.
knew that we needed masks?
Yes.
That's people helping people. Thank you. All right, let's wrap this day up. The first thing that I want somebody to tell me about is the hashtag coronavirus challenge.
Licking toilet seats.
So there's a coronavirus challenge that's trending on social media where you lick a toilet seat, like as a dare, or like to try to give yourself the disease, or like, look, I licked it and I didn't get coronavirus.
Yeah,
Basically.
We've moved beyond.
What makes them think that the coronavirus lives on toilet seats, preferentially?
The model that started it licked a toilet seat on an airplane.
Why not a door handle or a,
That would be a little more.
right?
Yeah.
A toilet seat. Hashtag idiots. We had a patient call this morning and ask if, what was it?
If you could drink water and then put a blow dryer in your mouth and turn it on high heat to kill the coronavirus.
Okay, so don't drink water and put electrical appliances in your mouth, and that probably will not kill the coronavirus. It might kill you and then kill the coronavirus. Updates on the specimen collection center next week is what we're expecting for that. Now that we have complete PPE equipment, we can do coronavirus testing officially as of now. We're still having to ration it a little, right? We don't have unlimited gowns, but after we swab someone that we have a high suspicion, then we're gonna have to ditch that gown. And the gloves. Let's not keep the gloves either.
I wouldn't recommend it. Yeah, that's a good idea.
Yeah, let's get biohazard outside. Or if you could just back your car up, we can put it in your trunk.
Sure, not a problem.
Okay, thank you. So the national issue is the inadequate supply of test kits. Been talking about it for weeks, and we're feeling it today for the first time. So now that we have kits, we ordered the initial 15 about 2 weeks ago, but we didn't have any of the equipment, so we couldn't use our kits. Now that we have the equipment to do the testing, we're wanting more test kits and struggling with getting those things. So we can't be doing it on just anybody. I see why they have the inclusion criteria to sort of restrict who's tested, because the kits are so limited. We can't be doing it on everybody, so it'll be the high-risk patients only for sure, the ones we have high clinical suspicion that have COVID. Don't lick toilet seats is the moral of today's meeting. And what should we do? Just like stack a hand and then
My hand's gonna
hand
be
and
sweaty,
then
so you're all
hand,
glove.
and then who's going next? You?
You gotta go on top.
Here.
Cold or stacking.
Get a hand. Yeah, get it in. Ready? Break! That's the hand sanitized break. I'm not going to close out today's video without doing some hand washing. You know, now that we're doing the coronavirus testing here at the clinic starting today, I feel like I'm truly inviting this virus closer to my life and the life of my employees. So now more than ever, proper hygiene is important. Good. Rinse. Shake that water off. And that's it. Good night.